Dear boys, welcome to my online class. I hope you all are well at your respective houses during this corona pandemic. Boys, we are passing too much crisis time. In this time, it is essential to protect yourself. So don't go outside, stay at home, and wash your hands frequently. I am Pradipta Kumar, Assistant Professor of Geology, Bhushan Cat College. Boys, look at this picture. This man feels chest pain. So I think you can understand what is my today's topic. Yes, my today's topic is different types of heart diseases. My today's lesson is for class 11, chapter 4, and name of the chapter is blood and circulation. My today's lesson is prepared with the help of this book, so you can also study this book. At the end of this class, you will be able to explain the causes and prevention of angina, explain the disease of arrhythmia, explain the warning signs, treatment and prevention of heart attack disease, explain about heart failure, explain the treatment of heart disease. Angina. Angina is a specific type of pain in the chest caused by inadequate blood flow through the blood vessels of the heart muscles. Look, boys, this is coronary artery and this is fat or plaque. So when fat is stored in the wall of coronary artery, then blood does not spread all the heart muscle. This is coronary artery. So this artery wall is when contracted due to fat, then the heart muscle cannot get enough oxygen or nutrient. For this region, the muscle of heart has been damaged. This is and for this region and we feel chest pain and this is called angina. It is common among the males with 55 years of age. So, uh, so male is affected when the age of 55 years, and woman is age is 65 years. So male is the early affected by this disease. Look at this picture. This is historical view. This is coronary artery. Transverse section of coronary artery. This is the yellow color. This is plaque or fat, and this is diametric figure. So look, the fat is stored in the wall, and for this region, the diameter of coronary artery is closed, so blood does not go smoothly. So heart muscle cannot get enough oxygen, and for this the muscle of heart has been damaged. Risk factors: diabetes. Who have who are diabetic patient, they are the risk of this disease. Habit of smoking. Smokers are affected by the disease. Hereditary. This disease is affected transmitted by gene. So whose family have affected by the disease, so they can also affected by the disease easily. Hypertension. Hypertension is one of the risk factors. Kidney disease. Who have kidney disease, they can also affected by this disease easily. Sedentary lifestyle. Who are idle, who cannot work hard working, they can easily affected by this disease. Prevention. In order to avoid this type of heart problems, we need to be physically active enough, avoid smoking, avoid high fat containing foods, avoid stress where possible. Arrhythmia. Sometimes the heart's electrical system does not function normally. It may race, become slow, irregular, skip beats, or sometimes the heart's electrical signal does not move in the proper sequence. This causes the heart to beat faster or slower than normal or erratically. These abnormal rhythms are called arrhythmias. Look, This is SA node, sino-auricular node, and this is AB node, atrioventricular node. This node is create electrical signal, and this electrical signal then goes to AV node, and AV node spread all over the heart muscle. Then heart muscle contracted and heart pump their blood throughout the body, all over the body. And this SA node does not create electrical signal properly, then heart muscle cannot contract it smoothly. Then this disease is called arrhythmia. Now another disease, heart attack. When blood flows in any part of the heart, that stops blood circulation. This causes the damage of cardiac cells. It results in myocardial infarction or coronary thrombosis, which are commonly known as heart attack. So heart attack is also known as myocardial infarction or coronary thrombosis. Look, chest pain beginning. It is the symbol of heart attack, sign of heart attack. So partially blocked of coronary artery causes angina. Chest pain is also called angina. When fully blocked, it causes a myocardial infarction or a heart attack. When the coronary artery is fully blocked, then it is called myocardial infarction or a heart attack. Warning signs: uncomfortable pressure, severe chest pain. Look, severe chest pain, particularly pain in mid chest, the middle portion, then pain or discomfort in one or both arms, the back, neck, jaw. So you can also feel in jaw pains or neck pains. Pain spreads from the left side to all over the chest. Left side to all over the chest. Other warning signs of a heart attack: shortness of breath, sweating, nausea, vomiting tendency, light headedness. Treatment: most people will need several kinds of medications or treatments after a heart attack. The aim of these measures is to prevent future heart attacks occurring. They may include drugs. You can take aspirin, angioplasty, and coronary artery bypass graft or CABG. This is the picture of CABG, coronary artery bypass graft. Prevention: the best way of preventing a heart attack is to have a healthy lifestyle. Measures for healthy living include the following: not smoking, eating a balanced diet, healthful diet, getting plenty of exercise. So you have to take exercise regularly, getting plenty of good quality sleep. So you have to take a sound sleep, and keeping diabetes under control. You have to control your diabetes, keeping blood pressure at a safe level, maintaining a healthy body weight. So you have to control your body weight also, avoiding stress where possible. Heart failure is one kind of heart disease. When a person has heart failure, the heart is still working but not as well as it should. Heart failure is defined as the condition when heart is unable to pump enough blood required for normal body functions. Actually, it is not the full stop of heart pumping. Heart failure can result from untreated coronary artery disease, high blood pressure, arrhythmias, and other conditions. These conditions can affect the heart's ability to pump properly. Heart failure can be life-threatening, but seeking early treatment for heart-related conditions can help prevent complications. Dear boys, now artificial pacemaker. The natural pacemaker may be weakened due to age and disease. The rate of heart decreases and even stops for some time, which may lead to inadequate blood flow to the body. This condition requires the use of an artificial pacemaker that generates its own electrical impulse and spreads them to the cardiac muscles through the electrode and helps in the heart's contraction and expansion. But look at this picture. This is artificial pacemaker. This is metallic box where is in present in lithium battery. That lifespan is 10 to 12 years. And this is wires. And the apex of wires is called electrode, which generates the electric impulse. This pacemaker located under the skin of chest upper right side. So the electrode is attached with right side of atrium, and if our natural pacemaker, I mean SA node is defected, then it is needed. Then this artificial pacemaker creates electric signal and is spread all over the wall of heart. Then the heart muscle can contract and expand it. For this reason, heart can pumping. So if our natural pacemaker is defected, then this I mean the artificial pacemaker is needed for our body. If the heart's electrical condition system is blocked or the natural pacemaker cannot work fast enough, the artificial pacemaker is used. The artificial is externally programmable so that the doctor can regulate the heart rate to an optimum level. Pacemaker three types: single chamber pacemaker, dual chamber pacemaker, and rate responsive pacemaker. Now, single chamber pacemaker. This kind of pacemaker is attached to only one chamber, either the atrium or the ventricle to generate impulse. Atrium or ventricle. Then dual chamber pacemaker. This kind of pacemaker is attached to two of the heart chambers, one at the atrium and other at the ventricle. So this type of pacemaker attached to atrium and ventricle. Rate responsive pacemaker. This kind of pacemaker responds to the patient's physical activity and maintains the heart rate according to the body's requirement. There are three wires to the pacemaker, one attached to the right atrium, one at the right ventricle, and other at left ventricle. So there are three wires of pacemaker, one attached to right atrium, another is right ventricle, and another left ventricle. Types of open heart surgery. The types of open heart surgery procedures include on pump surgery, off pump surgery, and robot assisted surgery. Which one is on pump surgery? On pump surgery uses a heart lung machine. There is a use one kind of machine that's name is heart lung machine or cardiopulmonary bypass. This machine temporarily takes over the heart's job of pumping oxygen-rich blood to the organs and tissues. This is the traditional type of open heart surgery. It allows surgeon to operate on a heart that is not beating and has no blood traveling through it. Beating heart or off-pump surgery does not use a heart-lung machine and surgeon operates on actively beating heart. However, surgeon will slow heart rate with medication or a device. This type of open heart surgery is limited to a few specific procedures. Robot assisted surgery allows surgeon to use a special computer to control robotic arms that perform the surgery. The surgeon sees a three-dimensional view of the surgery on the computer. This type of surgery is very precise. However, it also is limited to a few specific procedures. During surgery, the patients will receive medicine to thin blood and keep it from clotting. A heart-lung bypass machine will be connected to heart. The machine will take over patient's heart's pumping action and move blood away from heart. Look, this is grafting artery. When coronary artery block, then this is coronary artery and block, then another artery is attached with, and this is called bypass grafting. A specialist will observe the heart-lung bypass machine. The machine will allow the surgeon to operate on a heart that is not beating and that does not have blood flowing through it. This is the heart-lung machine. This machine pumps the blood. Look, oxygen poor blood leaves the heart to enter the heart-lung machines. So this blood goes to machine, and this by this tube, uh, the oxygen this blood goes to heart. Blood giving the heart lung. So this machine active the heart pumping, and then surgeon operate the heart. So blood bypass heart chambers and lungs. Location of heart. Look, this is the heart. This is aorta. Heart lung machine pumps and adds oxygen to the blood before it returns to the body. So the pumping it operating by this machine. This is called heart lung machine. First, look at these two pictures, and this is pump surgery and this is robot assisted surgery. Here there is no heart lung machine used. Uh, Heart is in actively beat here. Surgeon will operate this surgery directly. I mean, there is no machine used in here, and this is robot assisted surgery. I mean, here is in used in special computer monitor. Before operation, uh, surgeon will see the monitor, and then he operate the operations. So here surgeon see the three-dimensional view of this operation, so they can easily operate these uh, operations. So this is called robot assisted surgery. All figures are robot assistant assisted surgery, and this is op surgery. CABS, I mean coronary artery bypass surgery. In some cases, doctors may perform emergency bypass surgery at the time of a heart attack. Usually, your doctor may suggest that you have bypass surgery after your heart has had time to recover from your heart attack. Bypass surgery involves sewing veins or arteries in place at a site beyond a blocked and narrow coronary artery, restoring blood flow to the heart. Coronary artery bypass surgery, in this case, coronary artery or coronary vein both are um, bypass here. Uh, and by this case, in this case, the artery or vein collect from uh, arms or legs. Angioplasty is another treatment of heart disease. Angioplasty, also known as balloon angioplasty. I mean, here using balloons, so it is called balloon angioplasty. Is a procedure used to widen narrowed or obstructed arteries or veins. Look, this is plaque. So when plaque is stored in here, the cavity is closed. So here balloon is used. Then this balloon remove the artery, so the cavity is wide. This is called balloon angioplasty. A deflated balloon attached to a catheter is passed over a guide wire into the narrowed vessel and then inflated to a fixed size. The balloon forces expansion of the blood vessel and the surrounding muscular wall, allowing an improved blood flow. A stent may be inserted at the time of ballooning to ensure the vessel remains open and the balloon is then deflated and withdrawn. Look, this is stent. So This balloon open the artery wall, so then blood goes to heart muscle easily. This is called angioplasty. Okay, guys, have any question? If you have any question, then ask me through SMS or write in your inbox. Your sample questions. First question: which is a myocardial infarction, angina, heart failure, heart attack, cardiac arrest? Which one? Cardiac arrest is the right answer. Number two: pacemaker user patients face difficulty as because of use of mobile phone. Electric waves hampers pacemaker function. Kidney patients face problem. Which one is correct? 1 and 2, 1 and 3, 2 and 3, 1, 2 and 3. The right answer is 1 and 2. I mean, A number question is correct. Number 3. Risks for heart disease include heart blood pressure, lack of exercise, smoking. Which one is correct? 1 and 2, 1 and 3, 2 and 3, 1, 2 and 3. So, correct answer is D. I mean 1, 2 and 3. Now your homework. Mr. X is a government service holder. Nowadays, he feels discomfort in his chest, which lasts several minutes and becomes normal after a while. Besides, he feels unbearable pressure and pain in his chest. Number A. What is the full form of CABG? Number B. Why does heart failure occur? Explain it. Number C. Explain the symptoms of the disease mentioned in the stem. Number D. What can you think for prevention of the disease in light of the stem? Okay, boys, it's your homework. My next class is respiratory system of human body. Okay, boys, I want to say again, don't go outside, stay at home, and don't touch your face with your hands. Always stay at home and be safe. Thank you, boys, and see you in my next class.